Welcome to the Iferia TechCast. Here we bring you all things science, engineering, technology, and innovation. Today we are joined by Dr. Julius Torelli, a cardiologist with over 40 years of experience, whose practice has evolved in a fascinating direction. He has moved from traditional Western medicine to focus on a holistic platform he founded called Gratefully Well. He specializes in what he calls medically unexplained symptoms and uses a science-based approach to explore how mindsets, gratitude, and emotional resilience can directly impact our physical health. In this episode, we will explore the neuroscience behind his method and how we can become active participants in our own well-being. So, Dr. Torelli, welcome to the show. I am indeed honored to have you here today, sir.
Well, I'm honored to be here and thank you for the invitation.
All right, let's dive in. Your journey spans 40 years from traditional cardiology to founding the Gratefully Well platform. So, what was the pivotal case or realization that made you see the limitations of a purely physiological model and pushed you to integrate mindset and emotional resilience as core components of health?
Well, it all started the last week of medical school, believe it or not. I was doing a family practice rotation and a patient came in, middle-aged woman who had nausea and vomiting and dry heaving for about 3 days. She couldn't keep anything down. She was very sick. We saw her in the office. We didn't know what was going on, so we put her in the hospital. She was very dehydrated. We gave her some IV fluids and we ran some tests over several days, and everything came back normal. And so she was feeling a little bit better. So when I went to discharge her, I was sitting down to write her discharge orders and instructions, and I was making some small talk, and I said something corny like, "We're gonna." Get you home so you can get some real rest because you can't rest in the hospital, right? Everyone's always bothering you. And she said something curious. She said, "Oh, I wish." And I said, "What do you mean you wish?" She says, "I wish I could go home and get some rest." And I said, "Well, why can't you?" She says, "Well, in the last 6 weeks, my husband died. My husband left me. My dog died, and my house burned down. That was in 6 weeks." And at that moment, became intuitively obvious to me why she was sick. And if I went outside and asked, 10 people, random people, and told them the story, they would all say, "Oh, no wonder she was sick," right? Just this incredible amount of emotional overwhelm, as I like to call it, but we would call it stress in our society. In a very short, all of those things are a big deal, and in such a short time, not surprising that she was sick. The interesting thing is that that was the first thought I had, but the second thought was, wait a minute, I I'm finished with my medical school. I've got 2 days left to graduate, and I haven't learned anything about this entity. So then my third thought was, well, if I haven't learned anything about it, is it a real thing? Maybe it's not a real thing. And of course I said, well, if maybe I can go to the library and look it up. And I was like, well, I don't even know where to start. and then if I don't know what it is, or how do I treat this? And it was a busy time. I was moving. I was in Tampa, Florida. I was moving to Cleveland, but that patient stayed with me. And then as I started my training in internal medicine and then cardiology, I saw this type of thing over and over again, where we would see patients who had significant symptoms, sometimes debilitating symptoms, sometimes even disabling symptoms. And it didn't matter, could be anywhere. It could be headaches, neck ache, chest pain, belly pain, muscle aches, fatigue, right? And they were very symptomatic, and we would do all our tests and not find anything physical. But nonetheless, we would put them on medication because we didn't know what else to do, right? So I always say, in the toolbox for physicians, we have you open up the toolbox. The first tray in the toolbox is procedures. Well, if you have a headache and a brain tumor, you may need a procedure, or maybe it's surgery, maybe it's radiation therapy or something like that. But if the great majority of people who have headaches don't have a brain tumor, so if we don't find anything, we take out that tray out of the toolbox and we look for what else is in this toolbox to help people, because physicians do want to help people. The only thing left are pharmaceuticals, right? Medication. So we start with medication, even though we know that the foundational issue is has an emotional basis, as I like to call it, right? But we don't, we in Western medicine, we tend to, I'll just say, ignore that, because we focus essentially 100% on the physical.
Fantastic. That's a really interesting story and a incredible journey for you so far. So, speaking about medically unexplained symptoms, for our audience of systems thinkers, how would you explain the mechanism or the system failure that causes very real physical suffering when no traditional diagnostics test can find a physical cause?
Well, Ezekiel, you went right to the core question, right? That is the question, and it's a challenging one, right? But the truth is that, if you don't find anything physical, we know that the body is a dynamic biological system, right? It has
Mm,
sensors, it has processors, it has effectors. The symptoms all manifest physically, right? Headache or bellyache or fatigue, whatever it is. But what has caused this, let's call it, instability, this biologic instability, right?
mm,
And if you don't, so we concentrate on the physical, but the truth is that when you look at the dimensions of health, physical health is important, obviously, right? But there are other dimensions of health, like mental health, behavioral health, emotional health, spiritual health, cultural health, social health. These are all factors in that biologic system. You say, well, like, what do you mean? Well, picture this: you're in your house alone at night, and you're trying to fall asleep, and you're falling asleep, and as you fall asleep, you hear this noise downstairs, and you get startled, right?
yeah.
And it's a noise that you're not familiar with, so you get a bit startled. Now, if you measured your blood pressure before the noise, and then you measured it after, your blood pressure would be up, your heart rate would be up. We can measure all those things, right? And there's certain hormonal changes that are going on. And then after that noise, you maybe have some thoughts. Wait a minute, maybe I forgot to lock the door. Maybe someone broke in. Maybe, they're going to come up and harm me and my family or whatever, right? And so you start to have these thoughts. Now, if you measure the blood pressure, it's even higher. The heart rate is higher. Now your pupils have dilated. Your palms are sweaty, right? So these are very profound physiologic changes. Now you get up and you go and see, and you find something fell over and made that noise, and you recognize what it was. So there wasn't anything there. So the thing is that no one had broken in, but your physiology, your body was going through exactly the same physiology that would happen had someone broken in, right? So what happened? That was all from a thought. So these beliefs, these thoughts, this mindset is very powerful, has powerful physiologic effects. And again, you can measure those. How does that happen? Well, again, there are neurotransmitters and hormonal changes that occur within the brain. We understand this now. We have fMRI, we have all these tests that we can do, and we can show these changes that occur that start in the brain, in the subconscious, and then they move through the body. So we understand that, but in medicine we tend to ignore these powerful physiologic changes that occur with, say, mindset, emotions, thoughts, and let's just call it emotions, right? Emotions and beliefs. You can think of them as being regulatory inputs, not
Mm,
just noise.
interesting. So, from a neuroscience perspective, What's actually happening in the brain and body when someone consistently practices gratitude? Is it shifting neural pathways, changing hormone levels, or something else that we can measure?
Well, that's so. Again, it's kind of a feedback loop that starts right with the thoughts, and these neurohormonal neurotransmitter changes that are occurring. We start, if it's fear, it might start in the amygdala. It goes to the hippocampus. It moves through, but all of these, we can talk about the specifics of it, but the specifics aren't that important to know that that is going on. And that feedback loop, it's basically a protection mechanism, right? So the brain is a is it's it predicts. So there's a prediction loop in there, and in changing those, that prediction loop, you can interrupt that loop
Mm-hmm.
by a reframing the thought, right? Because thoughts sort of run away with themselves. So you can change that loop, or let's better use the changes, interrupt that loop with something like gratitude as an example. Because gratitude, the brain is sensing this, perceiving this fear. It's sort of trying to protect you, right? So like with the startled response that you had someone broken in, the reason your blood pressure goes up, the reason your heart rate goes up, the reason your pupils dilate is all to get more blood out to your muscles so you're stronger or faster, right? So that's a
Yeah.
protective mechanism, and it's a very appropriate mechanism if someone had broken in or if that you were in danger. But there was no danger, right? It was something that fell over.
Mm.
So again, that's an acute sort of situation. But if you take that to every day where you're anxious all the time and you have that neurohormonal loop going on all the time, your blood pressure will be up chronically, as an example. And then we would call that hypertension, right? That now has become an illness. So you can stop that loop, interrupt that loop with something like gratitude, because the gratitude then brings in and tells the body things are safe, and it changes that predictive model to safety.
Awesome response there. Really brilliant explanation. So, you talk about shifting patients from being passive to active participants. So, what does that activation process look like in practice?
So in Western medicine, unfortunately, people have given virtually 100% of their health and healthcare over to the healthcare provider, the physician or nurse practitioner, whoever it is. So, in other words, you wake up in the morning, you have a headache, you do your normal things. You take some aspirin or some Advil or Tylenol, whatever it is you take. And if the headache doesn't go away, or maybe it gets worse, or maybe these are recurring, then you decide this my home remedies are not working. I'm going to go to the doctor, and I expect now I'm going to turn everything over to him. So I expect him to figure out what's wrong, and I
Mm,
expect him to fix it. You expect two things: what's wrong and fix it. So maybe you have headaches, maybe he does an MRI or something that says you don't have a brain tumor; these are migraine headaches. So he figures out what's going on. Here are these medicines. We have medicines to prevent migraines. We have medicines to treat the migraine if you get the migraine. Maybe he thinks you're depressed, so he puts you maybe on an antidepressant. Maybe you're not sleeping well. I'm going to give you something to help you sleep. And maybe you have a lot of anxiety. We're going to give you something to help with that anxiety. So now you're on 3, 4, 5 medicines, none of which stop that loop that we talked about. None of them interrupt that loop. None of
mm.
them change the foundational issue, which is the emotional component. Well, again, what we would call stress, what I call emotional overwhelm, or just an emotional component to all of that. What people need to do, going to the doctor is fine. Making sure you don't have a brain tumor, absolutely. You need to have a medical evaluation, because even though 99.9% of people don't have a brain tumor, they still happen. And if it's going on, you need to know that, obviously. So you need to have a medical evaluation, whether it's belly pain or chest pain. Chest pain, make sure you're not having a heart attack. Belly pain, make sure you don't have appendicitis or Crohn's disease or something. Get a medical evaluation to make sure. But the great majority of the time, we don't find anything. And if we don't find anything, then how do we, what do you do? Well, here's where, again, if it's headaches, as an example, because we got pretty good medicines for migraine headaches, take the medicines will help. But as you're doing that, while you're doing that, go ahead and start to deal with these emotional issues. Maybe see a therapist, right? Start to learn what I would call parasympathetic stimulating or vagal toning, vagal nerve stimulation, to lower, right, to stimulate the parasympathetic nervous system, the autonomic nervous system, and relax or calm the system down. And there are many techniques to do that. Learn to meditate, learn things like yoga or tai chi, learn to chant or om or hum. These are all vagal nerve stimulating. So there are many things out there that you can do, but you have to do them. The doctor can't do them for you. So patients have to understand that. Diabetes is another great example, right? Yes, you do have to have diabetes. Type 2 diabetes is epidemic in the United States. So you have to be genetically predisposed to develop diabetes for sure. But after that, you can modify the expression of those genes based on your lifestyle. So most of that is due to lifestyle issues, lifestyle of being inactive, being overweight, eating a lot of ultra processed foods and things like that. So yes, if you're diabetic, take the medicine because it's going to lower your sugar, and that's an important thing. But then in addition, you have to tell the patient or educate the patient. Just telling them, I should say, education is the key. You have to educate them, and these are the lifestyle changes you have to make. The medicine will lower your sugar, but it's not going to cure your diabetes. You can improve your diabetes, reverse your diabetes, cure your diabetes potentially with lifestyle changes, increasing activity, right? Looking at the food you eat, losing weight, and things like that, and then dealing with these emotional issues. All of that is important. As diabetes is another sort of example. And that's not medically unexplained. That's obviously explained. But it's the same sort of thing. Patients need to take some responsibility for their health, or a certain degree of it.
Great. That was really, really insightful, dear. So, in the world of advanced medical technology, your approach is profoundly human-centric. So, what is the most significant pushback that you've received from the traditional medicine or traditional medical establishment, and how do you answer it with science and data?
Well, the interesting thing is that there's no pushback, basically.
Oh, wow.
And the reason for that is because I'm not advocating anything that is to remove from the traditional Western healthcare approach, right? This is an additive. It's an addition. So in other words, right, get your medical evaluation. If you need treatment, if you have diabetes, take the medicine. If you need surgery, get the surgery. If you have cancer, you might need chemotherapy and surgery. There's nothing here that says don't do that. Those are all fine, right? But in addition to that, so this is additive. In addition, let's also incorporate into the evaluation and the treatment of the patient these non-physical dimensions of health. Again, mental health, behavioral health, social health, cultural health, spiritual health. So, let's incorporate those into the evaluation. So let's not just say the person is only a physical being. That person is more than a physical being. So there's nothing to fight against here. There's nothing to push back. You can't really deny that, right? And physicians know this, but it's just easier to deal with the physical stuff because it's physical. We can manipulate the physical with chemicals, which are pharmaceuticals, right?
Yeah.
We can do all that, but and we can, and that's the other problem, is that we are very science based, right? And so in science, you have to measure things, and so the science, if we're going to follow just the scientific principles, that's fine, except it lends itself to only things that can be easily measured, so blood pressure, cholesterol, blood sugar, things like that. Those are very easy to measure. And you say, oh, look, when you do a study, people who have higher blood pressure, they do worse than people who have lower blood pressure. So that's the first study you do. You say, but okay, so high blood pressure is bad. So then the next study is, well, we have a drug, and if you give people drugs, it lowers blood pressure. So you say, okay, now we give this drug, and now the blood pressure is lower. Then you do a third study that shows when you use that drug and you lower the blood pressure, people do better, right? So it's kind of like three studies that that need to be done, or three phases of studies that need to be done to sort of show that. But to do studies with, measuring depression, measuring, looking at mental health, measuring emotions, measuring behavior, measuring, these cultural sort of psychosocial kind of factors, that's, yes, it can be done, but it's very difficult. There's a lot of variables. In fact, some people don't even consider it science because there's so many variables. Um, and so it's just easier to ignore that. And that, I think that's partly what happens. And so there's very little, if any, pushback to anything that I'm really doing.
Awesome, awesome. So, what has been the most rewarding or surprising outcome that you've witnessed in a patient who fully embraced your gracefully well model?
Well, if so the first book that I wrote on Amazon that's available is called Holistic Health Pathways, and that book is specifically includes the evidence that exists on the physical and mental health benefits of gratitude. So when I first started to do this and looking for tools, there's a whole body of literature, science, evidence that shows that gratitude has physical and mental health benefits. And so that's one of the reasons that was one of the first tools sort of implemented. And had one patient who was on the heart transplant list. She had an ejection fraction of about 10%. So the normal ejection fraction is about 60%. Anything less than 30 is pretty bad. Anything less than 20 is really bad. Hers was about 10. She was on a heart transplant list. She had been on the list for 3 years. They hadn't found her a donor. And make a long story short, she was getting progressively worse. The doctors recommended that she get a special kind of pacemaker. That was all appropriate. She refused because she was a naturalist. She didn't want anything artificial in her body. She refused and refused and refused, but she was getting worse. And she was in the hospital one time, and she said in a moment of weakness, she agreed to this pacemaker. They put the pacemaker in. She was worse. For the next 4 months, she had gone from being in the hospital every 3 or 4 months. Now she was in every week or two. She could walk before. She could walk about, I don't know, half a mile or quarter mile, something like that. I can't remember. Now she could only walk about 50 to 100 feet. She was much sicker, and she was very angry. She wanted this pacemaker out. She was like, I hate the thing. I want it out. And so we showed her how she could find a way. As I said, we had to go over everything, but I told her, you have a lot of anger toward this pacemaker. I said, a lot of resentment. I said, you have to appreciate this pacemaker. And she said, appreciate it. I hate it. I want it out. Can they take it out? I said, relax. I said, yes, they can take it out. I said, but it was actually an appropriate thing, right? It was. And she had a thing called a left bundle branch block. And this was a biventricular pacemaker. It was all appropriate stuff. But she was fighting against it. And so she says, how do I appreciate it? I hate it. And I said, I didn't say you had to like it. I said you had to appreciate it. And she said, well, how do I do that? I said, okay, we'll get a gratitude journal every morning, wake up, and you could write in your journal that morning. The first thing you might write is, one day I won't need this pacemaker and they can take it out. But for right now, I appreciate the pacemaker. I appreciate the company who developed the pacemaker. I appreciate that the fact that they make billions of dollars that they can do the research and development for this pacemaker. I appreciate the engineers who developed and thought of this pacemaker and designed this pacemaker. I appreciate the stainless steel that the pacemaker is made out of. I appreciate the leads that are made out of this. I appreciate the truck drivers who drove the stainless steel to the manufacturing plants to make the pacemaker. I appreciate the farmers who grew the food to feed the engineers or the truck drivers who drove and so I call that the traceback method, right? You can trace it to its origins, and that amplifies the gratitude. That I call that then awe-inspiring gratitude. So she did this, and over a period of about 4 or 5 months, she came off the transplant list. She was walking 2 miles a day. She had not gotten readmitted since she started the gratitude practice. and her ejection fraction improved from 10% to 30%. Now, if you say, well, was that all the gratitude? Well, what happened with the gratitude? The pacemaker was the right thing, but she wasn't allowing, she was fighting against the pacemaker. So she was so tense that she was essentially creating this system, right, where the tension was causing her blood pressure to be higher and things like that. If your blood pressure is higher in heart failure, that's not a good thing. So she was doing all these things. When she started to do the gratitude, basically she was allowing the pacemaker to do its thing. I don't know how else to put it. And so the gratitude was, would that have happened without the pacemaker? I have no idea. And I'm not going to say that because, again, the pacemaker was absolutely the right thing to do from a physical sort of, standpoint, but she was fighting against and not allowing that. And she did, I followed her for another 10 years, 8 or 10 years, and did fine off the transplant.
Fantastic. That was a really, really, really interesting response you just gave there. So, Dr. Julius, part of the theme of this podcast is centered around innovation. So, for that reason, I like to reserve at least one question on innovation for every guest that we have a conversation with on this podcast. So, in your work, which bridges hard science and uh, the profound influence of human consciousness, so tell us, what does the word innovation truly mean to you?
I think, it's a great question. So from my standpoint, we the body is a system, and we know that, but we limit that system to the physical. And again, we forget that it's a complex system and it has other non-physical dimensions within that system. And so the innovation, which doesn't seem straightforward necessarily, is again finding ways to integrate these non-physical dimensions of health into the evaluation and treatment of a patient. And so again, there's many ways to do that, but just the fact that we do just think about that, right? That is an innovative approach to the evaluation and treatment of a patient, which it shouldn't be,
Mm,
but it is, right? And I think it's things that we actually knew this hundreds of years ago. I mean, if you look at thousands of years ago, if you look at traditional Chinese medicine or Ayurvedic medicine,
yeah,
uh, those principles were there, and I think they were there in Western medicine at some point as well. But as our society has changed, as we implemented the scientific method, not to say that that was wrong, right? But again, because of that, there were certain things that happened, like we focused on the physical things that could be easily measured, and we discounted or ignored these more dimensions of health that were more difficult to measure. And so that innovation is really finding out how to do that. Now, devices are important. The technology is incredible, but we can get carried away with it. For instance, the big thing right now in medicine are vagal nerve stimulators. So we
mm,
have vagal nerve stimulators, which can be implanted or they can be external. But we have implantable vagal nerve stimulators, and people are using them to treat everything from heart failure to autoimmune disease. And again, they can show studies that show these devices may be effective, but you can tone the vagus nerve, by again techniques such as meditation and humming and singing and chanting and martial arts and things like that. So there are other ways to do it that are, where you don't have to go buy a device to put on your vagus nerve or on your chest. So, but again, people that have to do that, it's easier in this country. I don't want to have to go learn, Tai Chi. Just put this device in, or just I'm going to buy a device that I can wear on my neck that stimulates my vagus nerve.
great, great, great. That was an interesting one. So, finally, Dr. Julius, for our listeners who are inspired to learn more and take an active role in their health, so where can they go to find your resources and begin exploring your gratefully well model?
So the first place is I have a newsletter called Gratefully Well, which is on Substack, substack.com. If you go to Substack, you should be able to search for the newsletter or my name and find it. That's a free newsletter, and I write about these things there. In addition, there's a book on Amazon. I on my website gratefully.well.com. There's a 7-day gratitude challenge. You can go there, and again, that's free. You can take that 7-day gratitude challenge as well. And then there'll be another book that will be available on the website, not on Amazon. That'll be more of a course kind of product that goes over gratitude techniques. So the first book is more about the evidence that exists for the physical and mental health benefits of gratitude. This
Mm,
other book is more about techniques of gratitude. Gratitude journaling is fine. There's no problem with gratitude journaling, but it doesn't always work, and it's not always possible, right? So these are techniques that you can do more like on the fly, in the moment. And I go over that. The trace back method being the biggest one that's sort of discussed. Yeah.
all
But I
right.
encourage everyone to read. Most of the stuff will come through Substack, the announcements. So there'll be free workshops that I'll be doing, like 1 hour, 90-minute kind of workshops, and then eventually there'll be kind of closed group workshops with maybe 15 or 20 people, where we meet for once a week for like 6 or 8 weeks, and go over these things and try to do what I did one-on-one with patients more in this group setting.
Fantastic. Dr. Julius, it's been a really insightful conversation with you today, and I am totally excited to have you on the show.
I'm excited to be here, and thank you very much. It was great.